Hello dear friends, am I audible to you? Superstar Krishna Kumar and Roshni Ria, am I audible to you? Good evening Gauri Shankar. Yes, thank you very much for joining me on time. Now, this is our 19 subjects quiz that we have tried to start. Good evening Vainataya. Okay, so let's begin. This is 19 subject quiz. Before we start, let me tell you a small introduction about myself. I am Dr Meenakshi Sundaram AS, and I am a NEET PG educator, MBBS, MD, Gold Medalist in MD exams, and I've been a educator for Biochemistry and Microbiology for the past 11 years, and I have successfully placed students ultimately in the top institutions every upcoming year. And I'm a prolific quiz master, and I'm an international and national quiz master. So before we go to that topic as such, let me tell you something about the Plus subscription. We have daily live classes, structured courses, live tests and quizzes, unlimited access. If you'd like to take a Plus subscription, please use code Dr. ASM Live. I repeat, the code is Dr. ASM Live, DR ASM Live. It can fetch you 10% discount on your subscription and exclusive access to all my classes. And there is also something called as iconic subscription where you get the best of Unacademy and the best of Prep Ladder. And there are some special class features. You have interactive live sessions. You can answer polls. You can raise a hand. You can talk to the teacher directly. You don't have to miss a class because classes can be recorded. And you can have lecture notes at the end of the sessions. And you can attend the classes anytime, anywhere. And there are 25,000 plus high yield clinical questions. And these are the NEET toppers. You have a raise a hand feature in your app. And there are upcoming NEET PG Unacademy medical PG tests. These are the free test rituals, and these are the plus batch rituals. For those people who have subscribed, you can access these tests, and those who are free learners and special learners, you can use this particular topics. And these are the two batches that are upcoming and valid from December 27 till December 29th. If you buy for 24 months, you'll get 4 months discount, 4 months extra. For 12 months, you get 2 months extra, and for 6 months, you get 1 month extra. And you can subscribe now. You can use DRASM Live as code for 10% discount on this particular abstract, and you can have exclusive access to my classes. So shall we begin? Let me tell you, before I begin the session, let me tell you, this would be the Menti.com session. So yes, good evening Surya, good evening Ajay R. So let me tell you, I'm typing it out on the YouTube channel here. 326669997 is the Mentimeter code. Please use Mentimeter code. I have given you the code. Go to menti.com and use the code 326669997. So let me begin with the presentation. We can play the game as such. Yes, all of you, please join this session if you can, because you can join the session without joining the Menti code also. But if you join, your answers will be taken into consideration. You will be given marks for each of the questions that you have. If you're wrong, nobody will know that you are given a wrong answer. But if you're right, you will be able to come into the top 10. People will be able to know how much correct you are. So this is the good thing about going for this Menti session. Code once more, I have typed it here, Akhil Akhi. I'll repeat it once again, 326669997. This is the Mentimeter code. Can you not see? I have typed it here. Are you not able to see my type letters? Can you see it on the top? Can you see it now? on the top. I have typed it out for you. I am typing it here, 326667. I have typed it under Dr. Meenakshi Sundaram AS. Are you able to see? In this particular slide, whatever you are seeing on the top, can you see? Go to www.menti.com and use the code 32666997. Is it possible? Is it visible to you? If it's visible, shall we start? Yes. The number of people who have taken up the quiz, you are still trying to get into it. So if you're not able to see the letters clearly, please increase the quality of the video to high grade video on the YouTube channel. That will be helpful for you. Yes. So shall we begin the quiz? Please let me know if you're okay with this. Shall we start the quiz? Please give me a confirmation if we are ready to go. Again, please use the code 32666997 to enter into this quiz contest. Whatever kind of answer you would like to give, if you could give it in this particular mode, we will be able to calculate it for the right answers. So let's play for the first question here. Let's start with the first question. Yes. Answer fast to get more points. Patient with history of severe asthma is scheduled for an appendectomy. Which of the following induction agents will cause the least respiratory depression? Among the following, who causes the least respiratory depression? Ketamine, propofol, etomidate, thiopental. Among these, which one is known for causing the least respiratory depression? The first question is from anesthesia A. Out of 19 subjects, the first question is from anesthesia. We have 20 more seconds ahead of us. Come on people, give us an answer. Gaurav Barde, try to use the menti.com methods to give us an answer. You will be able to be scored. Yes, excellent. 9% of the people have given the right answer. It is ketamine. Ketamine, propofol, etomidate, thiopental. Out of 4, ketamine is known for causing the least amount of respiratory depression. There is no guarantee it won't cause respiratory depression, but it also might cause. But among the given 4, this is the least. Also remember, ketamine can cause emergence delirium. Here, in case of severe asthma, ketamine would be suggestive, because if a patient is having severe asthma and he also is given a drug which is capable of causing respiratory depression, the patient can enter into emergency status quo, without actually having any kind of warning signals. That is why ketamine would be preferred in the given situation. So let's see who is on top. Okay, Ronald is on top, Sayantan second, Janu third, Surya fourth, Hemalata fifth, Magical Rhino sixth, Bell seventh, Bill eighth, Earthman ninth, and Balaji 10th. Okay, so this is the leaderboard at the end of the first question. So we have just begun. All those people, we have 22 questions in 19 subjects. So if you could win this, it is the best way that you can actually make a preparation. Your NEET PG preparation is actually on the right path, I believe. So for that reason, let me tell you one thing. Go to menti.com. That is, it is given on the, see, it is given on the top of this particular slide that you're seeing. Go to menti.com and use the code 32666997. If you type menti.com on your browser, you will go to a page. In that page, there will be a small box, nothing else. In that box, you can enter the code 32666997. You can enter into this quiz contest. Just only one question is done. You can actually bring out your best of the ability. You can make it to the top 10 at the end of it. This is just to test whether you are on the right track towards your entrance exams. Okay, so let's go for the second question. Question 2 of 22. Come on, people. Let's begin. Answer fast to get more points. Boundary of triangle of auscultation is not formed by. Boundary of triangle of auscultation is not formed by A. Serratus anterior, B. Scapula, C. Trapezius, D. Latissimus dorsi. What is your answer? Yes, come on, people. Very well played. Yes, faster answers have been acquired. Anybody else? Yes, very good, very good. Amazing. Yes, you're answering faster these days. Come on. We have 15 more seconds. Anybody else? If you have any questions, you can ask me. Yes, the number of students participating has increased double. It has become double already. Okay, now let's see who has given the right answer. Yes, 21% of the people have given the right answer. The majority has given the right answer. The answer is serratus anterior. So remember, when you go for the triangle of auscultation on the back of your shoulder here, you will be having a small space which is not actually having intact muscles below it. There will be a small space, and in that space the sounds of the lung will be maximally heard. That is why you call them as triangle of auscultation. If you look at it, you're looking at the lateral border of trapezius becoming the medial border of the triangle, and the medial border of the latissimus dorsi becoming the lateral border of the triangle, and you'll be having the scapula, the vertebral border of the scapula becoming the part of the triangle. But serratus anterior is nowhere near the boundary of triangle. So remember, boundary of triangle of auscultation is not formed by serratus anterior. Most of the people have given the right answer. Let's see who is on top at the end of the second question. Okay, I think the top position might be changing. Okay, Sayanthan is on top, Surya second, Hemalata third, Ronald fourth, Bell is fifth, Earthman sixth, Aditya seventh, Balaji eighth, Lola ninth, and WW 10th. Excellent going. So we are done with only 2 questions. We still have 20 more questions to go. On your mark, people, come on. Again, for those people who have joined just now, only 2 questions are done out of 22. You can always be in the game. Go to menti.com that you can see on the top of the slide. That is, you can read on the top. Go to menti.com and use the code 3266697. Let's go for the third question. Question 3 of 22. Answer fast to get more points. But do not actually miss an answer. In cystinuria, all the following amino acids reabsorption defect is present, except which amino acids defect is not seen in cystinuria? A. Lysine, B. Citrulline, C. Arginine, D. Ornithine. Among the 4, which one is not defective in terms of absorption? Okay, we have 9 seconds. Okay, we have received almost 55 answers. Anybody else? Excellent. So the right answer would be, okay, the majority has gotten the wrong answer. The answer would be citrulline. See, in cystinuria, cysteine reabsorption will be defect. Also remember, there is a concept called as COLA, C-O-L-A, cysteine, ornithine, lysine, and arginine. So out of this, cysteine, ornithine, arginine, lysine, the one who are known for COAL col or COLA cola, they are the ones who are defective in reabsorption. Out of the citrulline is out of the vogue. Citrulline is not the amino acid whose reabsorption is defective. Also, citrulline is not a standard amino acid. Citrulline comes because of the combination of ornithine with carbamyl phosphate, and that will happen inside the mitochondria. Now let me ask you a question. Does anybody know this? If citrulline is not able to come out because of the defective ornithine transporter, if citrulline is not able to come out, what happens to citrulline? Anybody? If citrulline in the mitochondria is not able to come out, if citrulline in the mitochondria is unable to come out into the cytoplasm, then what happens to citrulline? Anybody knows? If anybody knows, please put them in the comment box section. I'll be happy if you could give me the right answer. So let's see how many of you got the right answer here. Again, in simple words, it is COLA cola that is actually having defect in the reabsorption. So Surya, Lola, IMSP, Ajay and RBS are given the right answers for this question. So that makes Surya the topper, Lola second, Sayantan third, IMSP fourth, Hemalata fifth, Ronald sixth, Ajay seventh, Bell eighth, Earthman ninth, and RBS 10th. Very well played, people. Let's go for the fourth question now. 4 out of 22. Answer fast to get more points. Danbury tremor is seen in A very simple, straightforward question from forensic medicine and toxicology. Yes, is it in mercury poisoning, iron poisoning, lead poisoning, and arsenic poisoning? Among the four, Danbury Temmins. Yes. For the previous question, Ajay R, you are correct. Lysine will react with the citrulline accumulating inside the mitochondria to form homocitrulline, and when the receptor called as when the transporter called as ornithine citrulline co-transporter or anti-transporter is actually blocked, you will be having accumulation of ornithine inside the mitochondria, or it will be unable to go into the mitochondria. You will be having citrulline assimilating inside the mitochondria, and it can form homocitrulline. That will cause triple H syndrome. We have 6 more seconds. Anybody else to give us the right answer? Come on, people. Yes, very good. So yes, the majority has given the right answer. It is mercury poisoning. Mercury poisoning is the best answer. Can anybody tell me the other names for mercury poisoning or Danbury's tremor? Can anybody tell me the other names of Danbury's tremor? Can anybody else tell me the other name for Danbury's tremor? It is Mad Hatter's disease. Anybody else? Yes, Hatter's shake, Mad Hatter's disease. Excellent. Very good, Vainithya and Manoj Kumar Chal again. That's a wonderful answer. So let's see how many of you have retained their top 10 position. Okay. Mad Hatter's shake. Very good, Hemalata. So Surya, I believe, is retaining the top position. Janu has entered into the top 10. So Surya, Sayantan, MSP, Hemalata, Bell, Ajay, Lola, Srinivas Balaji, Janu the Hustler, all of you are on top 10. So some people have actually gotten into the top 10. Some people have been pushed out of the top 10. Let's see how many of you can retain your top 10 position here. Let's go for the 5th question out of 22. Now on your screen. Answer fast to get more points. The most important indication for surgical repair of a bicornuate uterus is an OG question: infertility, dysmenorrhea, menorrhagia, habitual abortion. Out of the 4, what is the most important indication for surgical repair of a bicornuate uterus? Very good, Rajaram. Pink disease and Mad Hatter, both of them are correct. Anybody else? Okay, we have received 45 answers till now. We still have 18 more seconds. Anybody else? The most important indication for surgical repair of a bicornuate uterus. When you have 2 cornuae of the uterus coming up, what exactly can, see, all of them can be the problem. Infertility, dysmenorrhea, menorrhagia, habitual abortion, all can be the problem. But which one is the indication for surgical repair? Okay, so, 15 people have given about infertility and 16% have given about habitual. But the answer is habitual abortion. See, infertility need not always be the most important indication for surgical repair. It can be an indication for surgical repair, but among the given choices, the most important indication will always be habitual abortion. That is, when you say that, when will you say there is a habitual abortion? When the number of abortions or miscarriages are not less than 3. I repeat, when the number of miscarriages or abortions are not less than 3, at least 3 and more than 3, you will be going for surgical repair of a bicornuate uterus. So if you have not known this, make sure you remember this from now. Let's go for the leaderboard right now. Akhil, yes, hydrargyrism, not hydrarganism. Hydrargyrism, why? Because it is referred to as the liquid kind of silver. Mercury is called as liquid silver. Hydrargyrism, argyrism is for silver. Hydrargyrism, water-based silver or liquid silver. That is why you call it as mercury poisoning. Surya has been the top, Ajay 2nd, Sayantan 3rd, IMSP 4th, Hemalata 5th, the Hustler 6th, the Janu 7th, Vardhan 8th, WW 9th and Bell 10th. Vardhan and Janu the Hustler have been maintaining this position. Let's go for the next question here. Question 6 of 22, and if you have joined this quiz just now, those people who have joined the quiz just now, look at the top here on my screen, whatever you're seeing on the screen, www.menti.com, go to that on your browser and use the code 326669997. You will be able to play the game from now. Yes, Minamata's disease is because of, hey dude, Minamata disease is because of eating of the fish that have been poisoned. The fish who are carrying these kind of minerals because of, yes, when you have iodide, anhydride and chloride salts of the same heavy metal, the fish will be poisoned. When you eat the fish, raw fish, you'll be able to have this disease. So let's go for the 6th question out of 22. Answer fast to get more points. Aplasia cutis congenita occurs if the mother has taken which of the following medication? Aplasia cutis congenita. This is dermatology question. Lithium, warfarin, methimazole, propranolol. Out of the four, which one is known for causing aplasia cutis congenita if the mother is taking that medication? Come on, people. Aplasia cutis congenita. If the mother has taken which among these drugs, you will be able to have the mother's suffering is actually reflecting on the child. Aplasia cutis congenita. Yes, we have 7 more seconds. Anybody else? Come on, people. Excellent, Zul and Aijaz Ahmed Wani. The answer is methimazole. Both of you have given the right answer. But the only problem is that your answer will be right on the comment box section. I'll be able to tell your name as the right answer. But you will not be able to match yourself and see how exactly you're comparing with the other compatriots who are trying to give an answer. There are 21% people who have given the methimazole as the answer. So if you try to see for those people, Zul and Aijaz, it's just a request. You can go to www.menti.com and use the code 32666997. You'll be able to enter into the quiz right now, and you can actually compete with them. We are just done with 6 questions. We still have 75% of the quiz to go for. Okay. So Surya is still right on top. Ajay 2nd, Sayantan 3rd, IMSP 4th, Jano 5th, WW 6th, Bell 7th, Vardhan 8th, Setupati 9th, and Chintu 10th. Yes, so methimazole is the right answer. Lithium is not known for causing aplasia. Methimazole is known for causing aplasia because of the nitrogen ring present in the methimazole. And methimazole is also an anti-thyroid drug. Let's go for the question number 7 of 22. For those people who have joined just now, please go to menti.com as you can see on the screen right now and use the code that is seen on the screen 32666997 to enter into the game so that your marks will be counted. Answer fast to get more points, people. Come on, let's begin. Communication between middle ear and eustachian tube is obliterated surgically in which of the surgery? Is it cortical mastectomy, radical mastectomy, meringoplasty, modified radical mastectomy, or Bondi's mastectomy? Among the 5, which one is the commonest area where the middle ear and the eustachian tube space has been obliterated surgically? Okay, so yes, the majority has given the right answer, and that is also the right answer. The right answer would be, yes, the right answer would be radical mastectomy. See, whenever you went for modified radical mastectomy, you did not want the obliteration to happen. That is why the changes have happened. And Bondi's mastectomy is not much of a difference. Remember, in case of cortical and meringoplasty, you will be not able to allow the space to be present. See, in case of cortical mastectomy and meringoplasty, you will not be able to have any kind of impact in this area. But if the middle ear space and eustachian tube has been blocked, that is, the space has been attached or filled up, that is obliteration, then you have to think of radical mastectomy. The next best answer can be Bondi's. And for those people who got it wrong, I'm really sorry for this. Let's go for the next question. Before that, let's see the leaderboard here. The previous question, the right answer would be radical mastectomy. That was an ENT question. Okay, still Surya is on top. Surya is number 1, IMSP 2nd, WW 3rd, Ajay 4th, Jano 5th, Vardhan 6th, Setupati 7th, Sayantan 8th, Dr. Stark 9th, and Bell is 10th. Okay, Dr. Stark has entered into the top 10 position. Okay, let's go for the 8th question here. 8 out of 22. We are moving faster. Come on, people, keep up with us. Which of the following is a cause of sensorineural hearing loss? Which of the following is a cause of sensorineural hearing loss? Again, an ENT question. Number 1 is presbyaciosis. The number 2 is tympanosclerosis. Number 3 is otosclerosis. Number 4 is longitudinal fracture of the temporal bone. Number 5 is cholesteatoma. Out of which one can cause sensorineural hearing loss? A simple, straightforward question as such. A simple, straightforward question as such. Come on, people. Which of the following is a cause of sensorineural hearing loss? Yes, one more answer. Yes, we have 15 more seconds. Come on, people. For those who would like to join the session right now, look and read at the top area. Go to www.menti.com and use the code 326669997. Your marks will be counted. Let's see how many of you have given the right answer. Yes, maximum number of people have given the right answer. Almost 40% have given the right answer. Yes, the answer is presbyacusis. What happens in case of presbyacusis? You have old age degeneration. The neurons are dead, because of which you can have sensorineural hearing loss. But what happens in case of tympanosclerosis? Kahani Shukla and CP Singh in GMC, both of them are not the right answer, but everybody will be able to see your wrong answer. Instead, you can go to the menti.com and use the code 326669997 and enter your answer here. If you're right, everybody will be able to see your right answer. If you're wrong, nobody will be able to see it. That is the best advice suggestion I could give you. Okay, so remember, in case of tympanosclerosis, the tympanic membrane will be involved, the vesicles will be involved. In case of cholesteatoma also, you'll be having the conductive hearing loss. In all the other given 4 options, you will be having conductive hearing loss. Sometimes you can have mixed hearing loss in case of longitudinal fracture. The fracture can be longitudinal and transverse, where you can have mixed kind of hearing loss. But in all the other situations, it is conductive hearing loss. In case of presbyacusis, you can have sensorineural hearing loss. Now, there can be another argument. What happens in presbyacusis? If the patient becomes older and the bone is also getting degenerated, you may have a small portion of conductive hearing loss also. Let's look at who is on the top here. Okay, I think Surya is still on top. I am SP second, WW third, Ajay fourth, Janu fifth, Setapati sixth, Sayantan seventh, Pel eighth, Dr. Sark ninth, and Surya 10th. Very well played. Let's go for the next question. And those people who have joined just now, those people who have joined the quiz just now, do not feel alienated. You are a part of the quiz. You can always be a part of this quiz. Please go to menti.com, that is given on the top of this particular slide, and use the code that is given here, 326669997. If you're not able to see it, just have to increase your quality of the video. You have to click on the increase quality of the video on the YouTube channel. You will be able to access it. And if you could come on that, you will be able to answer it faster. So let's go for the question 9 of 22. Answer fast to get more points. Distichiasis is what? A simple, very simple, dead easy question from ophthalmology. Distichiasis or distichiasis is what? Misdirected eyelashes, accessory row of eyelashes, downward drooping of eyelid, outward protrusion of the lower lid. Out of the 4, what is the right answer? Distichiasis is misdirected eyelashes, accessory row of eyelashes, downward drooping of upper lid, outward protrusion of lower lid. We still have 15 more seconds. Anybody who would like to answer this? Come on, people. Okay, so majority have given the right answer, and that is the right answer. Accessory row of eyelashes. It's very commonly known as distichiasis. Distichiasis, many people say there is a second row of eyelashes that can be found. It's a very rare condition, but when you see that, you will be able to identify it from now onwards. Yes, Nitin Koshi, your answer is correct, but if you could put the same answer on the row, menti.com, and use the code 326669997, your marks will be counted for the bigger picture. You will be able to match and rub your shoulders against the toppers. You'll be able to know what is happening. Okay, so let's look at the leaderboard now. One ophthalmology question is done. So let's see who's on top. Surya is still on top. He is not giving a single answer wrong. IMSP is also correct. So both of them will be retaining the top 2 positions. Surya, IMSP, Ajay, Janu, Setapati, Sayanthan, WW, Dr. Stark, Surya, Jaggi. Now Jaggi has entered into the top 10 for the first time, and Surya is also there. Dr. Stark is still maintaining the top 10 position. Well played, people. Let's look at the next question here. For those people who have joined just now, please use menti.com and use the code 326669997 that you can see on the top of the screen, on the top of the, yes. Now let's go for the question number 10 of 22. Yes, let's start now. Answer fast to get more points. You're welcome, Nitin Koshi. Safe yield of a water supply source is the yield that is adequate for. This is a PSM question. 80% of the year, 90% of the year, 95% of the year, the whole year. The safe yield of a water supply source is the yield that is adequate for how much percent of the year? Is it 80%, 90%, 95%, or 100%? What is your answer? Come on, people, you can do it. Okay, the time is up. The right answer would be 95% of the year. It is not 90%, it's not 80%, it is the whole, it's not the whole year. So these are the areas where some simple kind of modulations can be done for your understanding. See, I understand most of you would have thought it is 90% of the year. That is why the majority has given, but that is not the right answer. It is for the 95% of the year. If you could actually attach to the 95% of the year, then that particular water source will be separate, called as safe yield of a water source. This is information that if you had not known, please know it from now onwards. No harm, no foul. So out of 55 students, 9 people only have given the right answer. Others, make sure that you will remember this for your exams. Okay, now let's go for the next question. Let's see the leaderboard here. Now IMSP, Dr. Stark and Srinivas Balaji only have given the right answers for this question along with Santosh. So they are making a difference. Surya, IMSP, Dr. Stark, Ajay, Janu, Sethupathi, Sayantan, Srinivas Balaji, WW and Santosh. So Dr. Stark has jumped to the third position. Excellent, Dr. Stark. Krishna Mohan, no Krishna Mohan. The answer is C. And if you would like to answer, you can go to the remedy.com website and you can try to use the code 32666997. And Dr. Stark, I'm really impressed with your sudden jump into the top area. Please reveal your name if you could like to. And Srinivas Balaji has also come back into the top 10. Santosh is in the top 10. Very good. Now this is becoming hotter. This quiz contest is becoming tougher now. Let's see the 11th question on the screen now. I'm interested. The protective effects of a breast milk are known to be associated with, this is a pediatrics question, IgM antibodies, lysozyme, mast cells, IgA antibodies. What is your answer? I'm actually excited now. I want to see who will be on the top 10 areas. And those who have been, see, if you keep answering in the comment box section, you will not know how much you would have scored. But if you try to come on that menti.com that you're seeing on the screen right now on the top, use the code 32666997. At the end of the whole session, you will know which rank you're holding among the 100 or 150 students who are answering this, and nobody will know your rank unless you are in the top 10. If you're in the top 10, everybody will know your rank. If you're not in the top 10, only you will know the rank. That is the good thing about this particular contest. So many people are given the right answer. We still have 5 more seconds. Anybody else? IgM antibodies, lysozyme, mast cells, IgA antibodies. Okay, excellent. So yes, majority has given the right answer. Almost 70% has given the right answer. The right answer would be IgA antibodies. ABCD, Mohan Chandra, Alex Armugam, Vijay Lakshmi. I'm really happy with your answer. All of you are correct. IgA antibodies. Why? Because colostrum contains IgA antibodies. The mucosal epithelia contains IgA antibodies. Why? Because IgA antibodies are called as the policemen of the mucosal epithelium. So secretory process can happen. And I'm really sorry, ABCD, Mohan Chandra, Alex and Vijay Lakshmi. If possible, please go to menti.com that is seen on the screen and try to use the code. That is, if you type menti.com and you will be able to enter into a website, a very simple website with only one particular page. In that there will be a small box. Use the code 32666997. If you answer it, at the end of the whole session, you will know what rank you are in comparison with that of other students who are taking the same test. Nobody will know the answer. Nobody will know your rank unless you are in the top 10. So this is my suggestion for you. Even Lalan Adhikari, very good. Now let's go for the leaderboard here. Surya, Ajay, Dr. Stark, Sayantan, Srinivas Balaji, WW, Surya and Jaggi have given the right answer. Okay, so this is the top 10 areas. Let's yes, JJ, general medicine is absolutely good for guy with any kind of essential tremors. But you should be loving the subject because general medicine actually contains the whole of medicine. You should be knowing something about everything in other subjects, and in case of physician activity, you'll be knowing more things about a particular topic. And when you become a DM neurologist, you should be knowing everything about neurology and not about anything else. That is what is expected. So question 12 of 22, let's go for the next question here. No problem, Mohan Chandra. Thank you very much for playing with us. A baby presents with multiple deformities, cleft lip, cleft palate, microcephaly, small eyes, scalp defect, and polydactyly. What is the probable diagnosis? Is it a defect in trisomy? It is defect trisomy 13, trisomy 18, trisomy 21, and monosomy 2. What is your answer? Okay, come on people, others, come on, turn in your answers. A baby presenting with multiple deformities, cleft lip, cleft palate, microcephaly, small eyes, scalp defect and polydactyly. What is the diagnosis? Okay, tell me, what is the diagnosis, people? How do you name it? Instead of calling it as trisomy or tetrasomy or monosomy, tell me what is the diagnosis in terms of words? Anybody? Can you tell me your diagnosis in words? Anybody? Yes, excellent. Patau syndrome. So this is Patau syndrome, trisomy 13. The baby has multiple deformities like what? Cleft palate, and cleft lip. You will not be having fusion of these areas when during embryological development. And because of the developmental area, when you have Patau syndrome, the skull will not believe it has to move upwards. The skull will not believe that it has to move in such a way that it has to accommodate more spaces. So the skull will actually be fixed and the eyes will be smaller, either because of microcephaly or because of its own activity, and scalp will be defective, but polydactyly is because of abnormal proliferation of your bones in the hands. Okay, we're going for question 13 of 22. Answer fast to get more points. Cholera toxin. Which of the four information is correct about cholera toxin? Increase the levels of intracellular cyclic GMP, acts on GM1 ganglioside molecules, causes continued activation of adenylyl cyclase, inhibits the enzyme phosphodiesterase. Out of the four, what is the right answer? This is microbiology question per se. We have covered at least 11 subjects. I mean at least 10 subjects. We still have 9 more subjects to go. Yes, what is the answer? We have 14 more seconds left. Come on, people. Cholera toxin, does it increase the levels of cyclic GMP? Does it act on GM1 ganglioside? Does it cause continued activation of adenylyl cyclase? Does it inhibit the enzyme phosphodiesterase? Yes, 3 more seconds. Anybody else? Okay, so well played, people. I understand the majority have not gotten the right answer. The people with 18 have gotten the right answer. See, it does not increase the levels of intracellular cyclic GMP. Intracellular cyclic GMP levels are activated by heat stable toxins. Heat labile toxins will activate cyclic AMP. So on that basis, option C is absolutely correct. It causes continued activation of adenylyl cyclase. What does adenylyl cyclase do? It will try to break the ATP and convert the ATP into cyclic AMP. So option A and C, they are parallel to each other. Cyclic GMP levels are elevated because of heat stable toxin, while heat labile toxin like cholera toxin will activate cyclic AMP. And also, does it act on GM1 ganglioside? No. It will bind to GM1 ganglioside receptor. I repeat, it will bind to GM1 ganglioside receptor, but the activity will be seen on the adenylyl cyclase. The activity can be seen on the receptor, not on the receptor, but on the adenylyl cyclase enzyme. So I hope you will be able to get the right answer from now. Let's look at the leaderboard at the end of this question. Surya is still on top. Surya, IMSP, Ajay, Sayanthan, Dr. Stark, Janu, Surya, Bell, Jiggy, Santosh. Again, the top 10 people have retained their top 10 position. Well played, people. Surya, who are you, man? You've been continuously getting the right answers. Amazing. Let's pray for you to be on the top at the end of the session also. We go for question 14 of 22. Yes, answer fast to get more points. Elimination rate constant is defined by the following parameter. Which one? Elimination rate constant. Is it rate of absorption, maximal concentration of substance in plasma, highest single dose, half-life called as T-half? Among the following, who will be defining the elimination rate constant? This is a pharmacology question. Let's see how many of you can get it right. Yes, we have 20 more seconds. You're welcome, Surya. Alex Aramugam, ABCD, that is not the right answer. I'm sorry. Okay, so the time is up. The right answer would be half-life. See, we are looking at elimination rate constant, K elim. KLM is the marker for elimination rate constant, and that is defined by the parameter called as half-life. The more the half-life, the lesser the elimination. The lesser the half-life, the more the elimination. That alone is a single parameter who can actually mark how much can be the rate elimination. Rate of absorption is not directly proportional to the rate of elimination. Also, maximal concentration of a substance in plasma may not be the rate constant elimination, because K elimination is a constant. So remember, the answer would be half-life. Highest single dose will be able to give you only the loading dose. Okay, let's look at the leaderboard here. Surya, IMSP, Ajay, Sayanthan, Jaggi and Srinivas Balaji having given the right answer. Srinivas Balaji makes an entry into the top 10 once again. Excellent playing. Okay, now let's look at the next question. 15 of 22. We are coming to the end of this session. Try to be on your top people. Let's go for it. Faster questions, faster answers, more marks. Answer fast to get more points. Indicate the local anesthetic which is more lipid soluble among the following. Who's the more lipid soluble kind of anesthetic? Local anesthetic: bupivacaine, lidocaine, mepivacaine and trocaine. Among the four, who is the more lipid soluble anesthetic agent? This is pharmacology plus anesthesia combined up together, but because they're asking for lipid solubility, you should treat it as a pharmacology question. Excellent. So majority have given the right answer. The answer would be bupivacaine. Lidocaine may be considered, but lidocaine is not as lipid soluble as bupivacaine. And please remember, bupivacaine has the ability of crossing across the biological membranes. Why? Because it is less ionized. The other compounds can have some amount of ionization, but bupivacaine has less amount of ionization. Remember this rule here: the more a compound is ionic, the lesser it can cross the biological membranes, and more it crosses the biological membrane, it has to be more lipid soluble. So hydrophobic compounds, lipid soluble compounds can cross biological membranes faster. So bupivacaine is less ionized and more lipid soluble and can cross biological membranes faster and better. So the answer is bupivacaine. Let's go for the leaderboard here. Let's go for the leaderboard here. Okay, IMSP has gotten it right. And still Surya maintains the top position. Surya, IMSP, Ajay, Sayanthan, Jaggi, Dr. Stark, Srinivasa Balaji, Janu, Surya, Bell. Okay, these people are continuously having a ring around roses for the top 10 area. Others try to break into the top 10. This is my humble wish. Come on, let's go for the next question. This is question 16 of 22. We have six more questions to go for. Others try to pick up your pace. We can make a difference. See, at the end of the whole session, you will be able to identify what you're in. In primary pulmonary hypertension, basic abnormality in gene lies in which one? Bone morphogenetic protein receptor 2, endothelin, homeobox gene, PAX1 gene. In primary pulmonary hypertension, what is the answer? You have 25 more seconds. Come on people, turn in your answer. Okay, anybody else? Okay, the time is up. The answer would be bone morphogenetic protein receptor 2. I understand endothelin receptors can also be involved, but we are focusing on the primary pulmonary hypertension. The abnormality in gene will be the BMPR2. BMPR2 mutation is the one that can cause primary pulmonary hypertension. In endothelin receptor mutations also you can have pulmonary hypertension, but you won't call them as primary, or many less amount of authors will be calling it as pulmonary. Can anybody tell me what is the defect in case of PAX1? Can anybody tell me what can be the defect in case of PAX1? What is the defect in case of PAX1? And if at all possible, can you tell me if there is a defect in homeobox, what can be the disease? Anybody? Okay, try to put in your answers in the comment box section, or you can take it as homework. Now we will be looking at the leaderboard here. Sayanthan and Surya alone have given the right answer for this question, I understand. Okay, aniridia can be seen. Okay, possible. So this is the leaderboard at the end of this area. Now let's go for the 17th questions out of 22. So for those people, okay, B cell, what B cell? B cell, what happens in B cell? Can you give me a more specific answer? Tejashri Santapeta. Okay, look at this. We are going for the 17th question out of 22. Last 5 questions to deal with. You don't have to feel bad about yourself. If you could stay till the end, till all the 5 questions, all the 22 questions are done, you will be able to get an idea which rank you are holding amongst all the people who have answered. That will be a motivation. You don't have to skip. If at all you think you will not be able to make it to the top 10, just because you can't make it to the top 10, you don't intend to fail in the exams. Do you understand this? So please don't do that. For example, if India is supposed to chase a huge target of 350, but India is losing almost 5 wickets for just 40 runs. Now, the other batsmen are not supposed to throw away their wickets. And if two people decide they have almost 40 overs to play for, India scored only 10 overs. They played for 10 overs and got 42 runs and they lost 5 wickets. They still have 40 overs. The remaining 2 people can take it as a batting practice. They can slowly bat and at the end they can get the team to the respectable total. If they get it to 300, the whole world will be very proud of them. And that is how the net run rate also will be making them a better place. So likewise, if at all you're not going into the top 10, it doesn't mean you have to skip the race. So just ask yourself what kind of rank you can get among this area. Let's go for the 17th question. Try to answer this. Answer first to get more points. Which of the following is an autosomal dominant metabolic disorder? Is it cystic fibrosis, phenylketonuria, alpha-1 antitrypsin deficiency, familial hypercholesterolemia? Which among the 4 is an autosomal dominant metabolic disorder? Okay, we have 25 more seconds. Come on, people, you can do it. Wasim Akram, is that your real name? I'm a fan of Wasim Akram because of the swing that he can generate. I hope you also will be able to swing the questions right and left. Come on, Wasim Akram. Anybody else? Okay, excellent, Vicky. The answer is right. The answer is D. Familial hypercholesterolemia is the right answer. Answer D is the right answer. Cystic fibrosis, phenylketonuria, alpha-1 antitrypsin deficiency, all of them are autosomal recessive disorder. Remember, most of the metabolic disorders will be recessive disorder, except in case of a few variants like familial hypercholesterolemia. And cystic fibrosis, the CFTR mutation, yes. CFTR mutation. Excellent, Tejashri Santapeta. For B cell maturation, PAX gene is required. So B cell maturation defect can be seen, because of which poor amount of antibody production can be seen and poor plasma cell can be produced. Very good, Tejashri. Let's go for the leaderboard at the end of the 17 questions. Surya still on top. IMSP, Sayantan, Ajay, Surya, Dr. Stark, Janu, Bell, Jiggy, the Hustler. They're on the top area. And Surya has actually rushed to the top 5 area. Very good playing. Okay, so we're going for the last 4 questions. This is question 18 of 22. Come on, people, you can make a difference. No, I'm just saying PAX mutation. PAX is important for Sahitiyada. PAX is important for B cell maturation. You can also have NTD. PAX is a bigger area. You can also have another area because depending on the different kinds of PAX genes. Okay, let's go for the 18th question. Did I say PAX1? If I said PAX1, I'm sorry. Which of the following is a link between the nervous system and the endocrine system? Which of the following is a link between nervous system and endocrine system? Midbrain, hindbrain, hypothalamus, thalamus. Among the 4, which one is the right answer? A simple question, physiology question. Come on, people. We have 23 more seconds. Come on. Any other answer? 10 more seconds. Come on, people. S. Vicky, great playing. Okay, so I believe most of you have gotten the right answer. Yes, almost 90% people have given the right answer. The answer would be hypothalamus. Hypothalamus is the direct link between the neuron systems and the endocrine system. You can have neuroendocrine fibers that are capable of sending you signals. Yes, very good, Joy Majindra and Vicky. So let's see the leaderboard now. whenever a question is easy, the majority can give the right answer. So that will actually be difficult for making a ranking. That is why we use this kind of system to give rank depending upon the speed. Surya is on top, IMSP second, Sayantan third, Ajay fourth, Surya fifth, Dr. Stark sixth, Janu seventh, Bell eighth, Jiggy ninth, and Srinivas Balaji 10th. Okay, these people have again retained the top 10 position. Okay, let's go for the 19th question out of 22. The last three questions on screen now. So answer fast to get more points. Dumping syndrome is due to, we have a surgery question here. Dumping syndrome is due to what? Is it because of diarrhea? Is it because of presence of hypertonic content in the small intestine? Is it vagotomy? Is it reduced gastric capacity? Out of the four, what is the right answer? It can cause dumping syndrome. Okay, we have 29 more seconds. Anybody else? It's not about the capacity per se. Excellent, Dr. Balamurali Krishnan. That's a wonderful answer. See, yes, the right answer would be presence of hypertonic content in small intestine. Can you please tell me what causes dumping syndrome? Anybody? When do you think dumping syndrome happens? Anybody? When do you think dumping syndrome happens? Dumping of content. Dumping syndrome happens because of what? Anybody? Surgery people? Yes, it can happen in Billroth procedure. Anything else? Yes, you have osmosis, large amount of food. Very good. Gastric bypass, removal of the part of the stomach. So whenever there is a surgery that can actually cause a bypass, you will be able to have some kind of hypertonic content in the small intestine. Because of osmosis, dumping syndrome will be possible. It's not just because of reduced gastric capacity. Gastric capacity may be reduced with multiple methods. But when you go for a bypass, the bypass can make sure the presence of hypertonic content in the small intestine can be present. So surgery question done. Let's go for the 20. Okay, leaderboard. Yes, gastrectomy. Very good. Sayantan, Ajay, Surya, Janu, the hustler have given the right answers. Okay, Surya, Sayantan, IMSP, Ajay, Surya, Janu, Dr. Stark, the hustler, Bell, Jiggy have given the right answers. Anybody else? So we have last three questions to go for. Question 20 of 22. Answer fast to get more points. Embolism in cerebral artery occurs most commonly in middle cerebral artery, anterior cerebral artery, posterior cerebral artery, cerebellar arteries. Which one is the right answer? Okay, so the right answer is middle cerebral artery. Most of them have given the right answer. So can anybody tell me, if there is a middle cerebral artery embolism, what do you think will be the result? If there is an embolism in middle cerebral artery, what do you think is the result? Middle cerebral artery embolism, what do you think is the result? Lalan Adhikari, you're also correct. Vicky, you're also correct. Anybody else? When you have embolism in cerebral artery, what do you think? Middle cerebral artery, what do you think happens? Excellent. That is how we discuss a case of hemiplegia. When you go for a final year exam, you will be able to speak about the hemiplegia happening. You speak about the middle cerebral artery mostly. Okay, remember this, final year students. Not always hemiparesis. We think about that artery because of the reason behind hemiplegia. Okay, so Surya, Sayantan, Ajay, IMSP, Surya, Janu, Dr. Stark, the hustler, Jeggy, Ronald have given the fastest. Ronald has given the fastest answer. This is the top area. Excellent. Contralateral hemiplegia can be noticed. Very good. Manoj Kumar Chaul again. Okay, this is question 21 or 22. The last two questions out of the area here, and try to answer both of them to see where you stand at the end of the session. Only you will be knowing what your rank is unless you are in the top 10. Okay, so answer fast to get more points. The Fraunhofer zone is the radiology question ultimately. The Fraunhofer zone is the image plane, image focus, near field, far field. What is the right answer? The Fraunhofer zone is the image plane, image focus, near field, far field. Which one is the right answer? Anybody? I named the topic as 19 MCQs, but I've added 22 MCQs ultimately because some questions were very difficult to let go of. Okay, 45 people have given the right answer. Image plane, image focus, near field, far field. The right answer is far field. See, Fraunhofer zone is the name that you use in radiology whenever in case of your image area is coming very far away from the antenna. Your image will be far away from the antenna. You can call them as far field or far zone or far focus. These are the three areas that have been done. So if you have never heard of this zone, please make sure you go back and read this. Fraunhofer zone is the far field area. I repeat once again, Fraunhofer zone is the far field area, far away from the antenna. The image being formed far away from the antenna. So only 9 people have given the right answer. This is the leaderboard. Surya, Sayantan, Ajay, Surya, IMSP, Janu, The Stark, Dr. Stark, Hustler, Jiggy and Bell. These people have retained the top area. Okay. Rashmi Ranjan Padi, no. Lala Adhikari, D correct. Joy Madhundar correct. ABCD correct. Let's go for the last question of the day. Question 22 of 22. Answer fast to get more points. In case of reimplantation of an amputated digit, which of the following structures is fixed first? This is an orthopedics question. When you go for reimplantation of an amputated digit, which one will you fix first? Bone, artery, vein? No. Which one is fixed first? Bone, artery, vein? No. Which one is fixed first? Pseudoephedrine hydroxy. I think you have come late. Okay, you joined late. Very good answer. Monisha, Lakshavir. We have 3 more seconds. Okay, the time is up. Always remember the bone is fixed first, only then surrounding that artery, vein and nerve will be fixed. The right answer would be the bone. Fixing bone will be the first thing to happen in reimplantation of an amputated digit. So we have done with the orthopedics question. Let's see the leaderboard and let's see who is on top. Okay. Surya, Sayantan. Okay, Surya, Sayantan, Ajay, Surya, IMSP, Janu, Ronald, Bell, Dr. Stark, Earthman. Earthman at the last moment has come back into the top 10. Very well played, Surya. Amazing, Surya. Congratulations to all the people who made it to the top 10. And for those people who didn't make it to the top 10, you will be able to see what exactly you got. You got in your, got as your rank. Now I have a question. Would you like to have such kind of 19 subjects MCQs? Would you like more such sessions of 19 subjects in one go? Okay, yes. Thank you, Sudhafedrin, Akhil, Nitin, Dr. Yash, Shantan, Vijayalakshmi, Surya Nandana, Manoj Kumar, Rijo, Alex, Niharika, Poco, Surya M. Yes. So when would you like it again? If possible, we'll do it on 30th or 31st of December, or we'll do it on the first week of January. Okay. You can rerun the same video. You will be able to find them better. All the very best to all of you. Thank you very much for playing this game. It was a wonderful session with you. And yes, we will do it either on 30th and 31st of December. I'll think about it. Or we'll do it on the first week of January. And please put a thumbs up at the end of the session. It can help other people also watch it more. And thank you very much. Oh, thank you very much, Sudhafedrin. Thank you. I don't think I'm the greatest of all time, but I'll try my best to live up to your expectation. And have a great day. And for those people who are interested, at 9 p.m. tonight on the Unacademy app, we have 100 MCQs marathon session for anatomy, physiology, and biochemistry. If you would like, you can join me again. I repeat once again, at 9 p.m. that is in the next half an hour on the Unacademy app. On the Unacademy app, we have 100 MCQs marathon part 1, fresh part 1 in anatomy, physiology, and biochemistry. If you're a first year student, or if you know anybody who's a first year student, you can ask them to come back, ask them to download the Unacademy Learner app and ask them to use the code Dr. ASM to unlock the free classes. If you already have unlocked them earlier, please come back to the session. And if you are in a final year mode or in your NEET PG revision mode, these 100 questions, at least we'll be doing 50 questions today. You can actually learn a lot in the next half an hour. So thank you very much all of you. This is my humble suggestion. You can come at 9 p.m. today. The part 2 will be 9 p.m. tomorrow. At 9 p.m. tomorrow, we'll be having part 2 in the same Unacademy app. You can use the same code Dr. ASM to unlock the free code. Both of them are free sessions. Thank you very much. Santosh Kumar, thank you so much. You can come for the class at 9 p.m. to answer questions in anatomy, physiology and biochemistry. It will be a combination of recall questions, concept-based questions, logic-based questions, creativity. All 4 will be combined in the 50 questions we'll be facing today, and we'll be having 50 questions tomorrow. Thank you very much for playing along. Please put a thumbs up if you like the class. Thank you. Bye-bye.